I'm presenting on the topic of multiple sclerosis. And the members who put this presentation together are Arvinal Sandy, Davy Silal, Che Tyson, Kayla Wilson, and Leanne Wynn. What is multiple sclerosis? Multiple sclerosis is a chronic disease that affects the central nervous system, which includes the brain and the spinal cord. It occurs when the immune system mistakenly attacks the protective covering of the nerve fibers, known as myelin, causing degeneration of the cell. This damage disrupts the normal flow of electrical impulses along the nerves, leading to a wide range of problems that causes numerous abnormalities that varies differently depending on the nerve and the nerve location. What is myelin? Myelin is a sheath-like material that forms an insulating and protective coating around nerve fibers. This myelin sheath allows electrical impulses to transmit quickly and efficiently along the nerve cells. If myelin is damaged, these impulses slow down or even stop. The image above is showing a healthy nerve and a nerve affected by MS. As you can see, the myelin in the healthy cell is fully covered and has no lesions. In the one affected by MS, the myelin is damaged and you can see there is lesions along the sheath. And what is happening is that the body immune system is identifying myelin as a foreign body. The sheath is slowly destroyed, exposing the nerve fibers to lesions. This damage alters the messages within the CNS, the central nervous system, causing neurological symptoms of varying degrees of severity. So now we are going to look at the epidemiology and prevalence of MS. So in this table, it shows the number of multiple sclerosis per 100,000 by the world region in 2013 and 2020. So it shows different countries and regions between the 2 years. The estimated number of persons with MS worldwide has increased to 2.8 million in 2020. When applying the same method as in 2013, the estimate is 30% higher than in 2013. The 2020 global prevalence is 35.9, running it off 36 persons per 100,000 people. So there shows that compared to 2013, there has been a 30% increase from 2013 to 2020, making it show that around the world and regionally there has been an increase in MS prevalence. Only 14% of countries with data at both time points reported stable or declining prevalence. So only 14%, meaning that only 11 out of 81 countries have shown a decline in prevalence. Recognition of pediatric onset MS has increased substantially, with over 30,000 cases of MS diagnosed in individuals under 18 years of age, reported by 47 countries. In 2013, 7,000 cases were reported by 34 countries. Globally, females are twice as likely to have MS as males, and this is consistent with both prior editions of the atlas. However, the ratio of women to men is as high as 4 to 1 in some countries, and others this ratio has doubled since 2013. We're going to look at the mechanism of disease development. Inflammation of the central nervous system is the primary cause of damage in MS. The specific elements that start this inflammation are still unknown. Studies have suggested that genetic, environmental, and infectious agents may be among the factors influencing the development of T cells, which are essential for MS pathogenesis. They react with self-antigens of the CNS. Such T cells initiate and propagate an autoimmune response against the CNS and orchestrate cellular and humoral effectors which attack myelin, oligodendrocytes, and neurons. To look at the role of the immune system. The immune system is the body's defense against infection and bacteria. With MS, the immune system treats the protective myelin coating around nerves like an infection. This leads to myelin being destroyed, with the body seeing the myelin coating like an antigen, and then the body then produces white blood cells, causing the body to destroy the coating. We're going to look at common symptoms of multiple sclerosis. So we are going to look at common symptoms of multiple sclerosis. You'll get firstly one, neurological symptoms, numbness or tingling, often in the face, limbs, or even trunk. You get some muscle weakness, difficulty in mobility or performing tasks, stiffness and involuntary muscle spasms, coordination and balance issues, dizziness, or a sensation of unsteadiness. You will get visual symptoms, blurred vision, loss of vision in one eye, often accompanied by pain during eye movement, double vision sometimes, or involuntary eye movements. Thirdly, you will get cognitive and emotional symptoms. You get memory and concentration issues, difficulty with focus, planning, or even problem solving. You will sometimes get mood changes, depression, anxiety, or emotional instability. A common symptom of multiple sclerosis can be fatigue, a common symptom often unrelated to physical activity. You get sensory symptoms, pain or burning sensation, or possibly a brief electric shock-like sensation when bending the neck. You have autonomic symptoms, bladder and bowel dysfunction, urgency, frequency, and even sexual dysfunction. You have difficulty with swallowing and slurred speech. We're going to look at diagnostic methods and criteria. Diagnosing MS can be complex, as its symptoms overlap with many other neurological disorders. A combination of clinical evaluations, imaging, and laboratory tests is used to confirm the diagnosis. The key steps include a medical history and neurological exam. The doctor will evaluate symptoms, medical history, and perform tests to assess vision, coordination, reflexes, and strength. You will need to do an MRI of the brain and spinal cord, which is the most critical tool for diagnosing MS. It identifies lesions or plaques caused by inflammation and myelin damage. Can do a spinal tap, analyzing cerebrospinal fluid for abnormalities such as oligoconal bands, which indicate immune system activity in the CNS. Evoked potential tests. These measure electrical activity in the brain in response to stimuli to detect slow nerve conduction. Blood tests. While no specific blood test can diagnose MS, they can help rule out other conditions like infections, lupus, or vitamin B12 deficiency. Diagnostic criteria. The McDonough criteria are commonly used, requiring evidence of CNS damage in at least two separate areas and at two different times. Treatment and management for multiple sclerosis. Note, currently there isn't a cure for multiple sclerosis. What there is, however, are treatments to help combat the symptoms of MS, reduce relapses, and to also slow its progression. Corticosteroids. This type of medication helps in reducing nerve inflammation. The corticosteroids used for MS are oral prednisone and intravenous methylprednisolone. Plasma exchange. This is a blood process by which blood plasma is removed from the blood, separating it from the blood cells. The blood cells are then mixed in albumin, a protein solution, and returned to the body. Disease-modifying therapies for MS. There are varying disease-modifying therapies for relapsing remitting MS. Some are beneficial to secondary progress MS, and one is available for primary progress of MS. There are three types of treatment medications to modify the progression of MS: injectable, oral, and infusion. The best treatment for an individual will depend on the different factors such as health conditions and how long you have had MS and your symptoms. Here we are looking at the treatment and management of multiple sclerosis. As the slide before, these are just the different types of treatment you can get for multiple sclerosis. You have the injectables, you have the orals, and we also have the infusion. You have the infusions for the treatment. Treatments for the symptoms of MS include physical therapy, muscle relaxants, medicines to reduce fatigue, and medicine to increase walking speed. We have emerging therapies and research on MS and the future plans for MS. So we have the BTK inhibitor. This is a current theory being studied in relapsing remitting multiple sclerosis and secondary progressive multiple sclerosis. How it works is that it alters the function of B cells, immune cells in the central nervous system. We have the stem cell transplantation. Essentially, this treatment would eradicate the immune system of someone with MS and subsequently replace it with transplanted healthy stem cells. There is an ongoing research on whether the therapy may decrease inflammation in MS victims and reset their immune systems. They can also be treated on therapies by blocking the CD40L protein, which is a protein found in T cells that is shown to play a role in MS. Researchers say that blocking this protein will help manage MS. We have the phosphodiesterase inhibitor. This is a new type of medication being studied as it works to decrease inflammation by changing damaging immune system responses seen in MS. The psychological and social impacts of MS. Now, this lady was diagnosed with MS, and she is sharing her testimony on how she took the information when she was diagnosed. She said, I relapsed and was hospitalized. To say I took it bad is an understatement. I now know that although diagnosis doesn't mean the end of my life, it does mean a different sort of life. Tasha, living with highly active relapsing multiple sclerosis. People being diagnosed with MS can be overwhelming, frightening, and distressing. For others, it can be a relief, especially if they've had symptoms which couldn't be explained. Others might shut down emotionally. Often, it's a combination of all the above. Getting the diagnosis could raise as many new questions as it answers, and reactions will vary from person to person over the time. Emotional and behavioral changes in people with MS can be influenced by personality traits, the disease itself, and medication side effects. Individuals with MS may experience depression due to the psychological impact of the disease or external stress like financial difficulty and social isolation. Depression is more common in MS patients but also affects those without the condition. Medications such as steroids, modafinil, and baclofen can cause mood swings, anxiety, or depression. MS has significant financial and social effects on people and their families. The societal impacts of MS are varied and go beyond the cost to the healthcare system and lost productivity, including disruption of education of young patients and community engagement. As this was a pilot study, further clinical studies are recommended, considering the psychological factors, the burden of the disease, multidisciplinary approach, and support groups. People with MS experience fatigue, which can impact their daily lives. It can lead to reduced capacity to work and a reduced ability to participate in society. Despite the challenges the disease brings, people with MS can and increasingly do stay in the workforce. So in conclusion, multiple sclerosis is an autoimmune disease that affects the central nervous system, causing symptoms like muscle weaknesses, vision problems, and coordination issues. It occurs when the immune system attacks the protective covering of the nerve fibers, which is myelin. While there is no cure, treatments aim to manage symptoms, reduce relapses and reoccurrences, and slow progression. Therapies and symptom management strategies help improve quality of life. Early diagnosis and ongoing care are essential for a better long-term outcome. Thank you very much for watching.